Welcome to the Bernade channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for a tracheostomy patient. Nursing diagnosis. Risk for infection. Related to presence of artificial airway, impaired immune system, or inadequate suctioning technique. Nursing diagnosis. Risk for infection. Part 2. As evidenced by vulnerability to pathogens, potential for mucus plugging, and need for frequent invasive procedures. Nursing diagnosis. Impaired verbal communication. Related to presence of tracheostomy tube as evidenced by inability to produce speech and potential frustration. Desired outcomes. One patient will maintain a patent airway without signs of infection throughout hospital stay. Two patient will demonstrate proper tracheostomy care techniques prior to discharge. Desired outcomes. Part 2. 3 patient will verbalize understanding of infection prevention measures within 48 hours of education. 4 patient will establish effective alternative communication methods within 24 hours. Assessment. 1. Assess tracheostomy site for redness, swelling, discharge, or odor every shift. 2. Monitor respiratory rate, breath sounds, and oxygen saturation every 2 to 4 hours or as ordered. Assessment. Part 2. 3. Evaluate characteristics of tracheal secretions, amount, color, consistency, each shift. 4. Assess patient's ability to perform self-care and communicate needs. 5. Monitor for signs of respiratory distress or tube obstruction. Nursing interventions. Airway management. 1. Perform tracheostomy care every 8 hours or as needed using sterile technique. 2. Suction tracheostomy as needed, monitoring secretion characteristics and patient's response. Nursing interventions. Airway management. Part 2. 3. Ensure proper cuff inflation if present, checking pressure every 8 hours. 4. Change tracheostomy ties or secure holder as needed, ensuring tube is properly positioned. 5. Provide humidified oxygen as ordered to prevent mucus plugging. Nursing interventions. Infection prevention. 1. Maintain sterile or clean technique during all tracheostomy care procedures. 2. Perform hand hygiene before and after patient contact or tracheostomy care. 3. Use personal protective equipment, gloves, gown, mask, as appropriate. Nursing interventions. Infection prevention. Part 2. 4. Change suction catheter and sterile water for cleaning after each use. 5. Monitor for signs of respiratory infection, fever, increased or purulent secretions. 6. Administer prophylactic antibiotics if ordered. Nursing interventions. Patient education. 1. Teach patient and caregivers proper hand hygiene techniques. 2. Demonstrate and have patient/caregiver return demonstration of tracheostomy care and suctioning. 3. Educate on signs and symptoms of infection to report immediately. Nursing interventions. Patient education. Part 2. 4. Instruct on proper cleaning and storage of tracheostomy supplies at home. 5. Provide written instructions and resources for home care. 6. Teach alternative communication methods, example writing, gestures, communication boards. Nursing interventions. Psychosocial support. 1. Assess patient's emotional response to having a tracheostomy. 2. Provide emotional support and reassurance. 3. Encourage family involvement in care and decision-making process. Nursing interventions. Psychosocial support. Part 2. 4. Refer to speech therapy for communication strategies and potential speaking valve use. 5. Connect patient with support groups or counseling services if needed. 6. Encourage expression of feelings about body image changes. Evaluation. 1. Tracheostomy site remains free of infection and irritation throughout hospital stay. 2. Patient or caregiver demonstrates correct tracheostomy care technique prior to discharge. Evaluation. Part 2. 3. Patient verbalizes or indicates understanding of infection prevention measures. 4. Patient successfully uses alternative communication methods to express needs. 5. Patient shows improved comfort and confidence in managing tracheostomy. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burn8 app for free from the Play Store or App Store for answers to more than 3,000 questions.